laparoscopic sleeve gastrectomy and laparoscopic Roux-en-Y gastric bypass, complications, short-term and long-term. I don't think a short video is the place to really try to discuss complications of the two procedures in depth. But I think it's fair to say that with both procedures in a good surgeon's hands, the risk of complications is low. With a sleeve gastrectomy, we worry most about a staple line leak, which can be very difficult to manage, very rarely taking weeks or months to heal. Whereas with a Roux-en-Y gastric bypass, we worry about anastomotic leaks. Mostly these will heal in a matter of weeks and probably aren't as difficult to manage as a sleeve's staple line leak. But there is very much a trade-off. A sleeve gastrectomy is very unlikely to cause long-term complications, whereas from time to time we will see long-term complications with the Roux-en-Y gastric bypass, which can be difficult to manage. In particular, we sometimes see abdominal pain that we can't easily find a cause for. Sometimes the laparoscopic Roux-en-Y gastric bypass will result in an internal hernia that might need further surgery to fix it. And occasionally with the Roux-en-Y gastric bypass, we see ulcers that can be very difficult, and again it can be difficult to make these heal. So there's very much a trade-off between the two procedures. The sleeve gastrectomy has a staple line leak, which can be difficult to manage, but is uncommon. Complications after the Roux-en-Y gastric bypass in the short term are usually relatively easy to manage, but the longer term complications can be difficult and can interfere very significantly with people's quality of life.